First up for you on this Wednesday morning, our first guest has a very unique understanding of the challenges surrounding health care in our country. Dr. Scott Morris founded the Church Health Center here in Memphis, a community clinic and wellness center that treats tens of thousands of uninsured people every year.
And Dr. Morris reveals what real health care should be in his new book, Health Care You Can Live With. And Dr. Morris, you say a big part of it starts with us and how we can actually take care of ourselves. So how do we do that?
Well, Alex, you're exactly right. What this book's all about, and really what the Church Health Center is all about, is not trying to find ways where people can use more technology, take more pills to be healthy. That doesn't lead anybody to be healthy. Now, I've come to believe that in America, we have an unholy love affair with technology. But we can live our lives however we want to because we are convinced that the doctor can fix me if I'm broken. Well, I'm sorry to tell you that the doctor's just not that smart.
And you also, doctor, use a term referring to authentic health care. What do you mean by authentic? Is this, again, doing away with some of the other things that you just mentioned?
Well, what I believe health is all about is not the absence of disease. It's about doing those things that make us happy. You know, people die saying, I wish I had spent more time with my grandkids. So the doctor, the experience of health care ought to be about helping each of us have more time with our grandkids, have more time doing the things that bring about joy, spending more time in community. That's how we ought to define health. Not about how many pills I take or how many surgeries I've had.
You have been preaching this whole wellness and total wellness, the whole picture, spiritual, emotional, and, you know, preventative physical types of care for years and years and years. Are more traditional doctors getting on the bandwagon and sending this message out as the healthcare system appears more broken?
You know, I truly do think that we have a movement in America around training young doctors, and that's what it comes down to, training young doctors in a way that's not just about intervention, but about keeping people healthy and whole. We have some philosophical problems. We've come to believe that you can take a human being and separate them into a body and a spirit. And we put the body on one side and say it's the purview of science and medicine. We put the spirit on the other and say churches and communities of faith can deal with that, but these two things should never connect. Well, on both sides, it's wrong. The church has forgotten that God gave us this body for a reason. And by the same token, people who are physicians and healthcare ignore that there's a spiritual dimension to life. Now, every person out there intuitively knows there's something wrong with that, that our bodies and our spirits are connected. Now, you don't have to necessarily believe any particular way for this to happen, but you've got to find a way to nurture the spiritual dimension in life, or a person will never be healthy.
Doctor, you also mentioned that, you know, some doctors, especially some younger doctors, are kind of buying into this system that you speak about. What about the government's role in all of this, you think? What should it be, especially with healthcare reform being such a big issue, as we all know, in 2010, and of course in 2009?
Well, we've spent 2 years on this debate, and we're getting ready apparently to spend another year redebating the same issue. The issue has been up to now how to pay for a system that does not necessarily make people healthier. The focus has all been on the money. It has not been on how to improve health. And since the focus is on the money, it is about paying for technology. It's about paying for things that might give us a prettier picture, but doesn't make people healthier. So the government's role, in my opinion, ought to be to fund research around true prevention. Fund things that help us understand the end of life. That nobody wants the government to decide when I'm going to die. I think that's really been a fault of the church and people of faith to let happen what happens now. Because what happens now is our grandparents spend the last 2 weeks of their life in the intensive care unit in a place where they never turn the lights off, with the tube stuck down their throat, around people who don't know them, who don't care about them, who don't love them, and then they die.
And who are trying to keep them alive for as long as possible when they're not really living.
We don't need to let that happen in America.
Do you even pay attention to what Washington does anymore, or have you given up on them asking the right people what they should do with health care reform?
Well, I am not naive in saying that this is a very, very complicated problem. But where we are off track, both on the left and the right, is over, the debate is all about how to pay for it.
Right.
You know, where we need to try to figure out somebody who's smart enough to move the debate over to what does real health improvement outcomes look like.
Right.
And that cannot happen in Washington. It can't happen in Nashville. Those sorts of improvements in healthcare can only happen locally, which is perfect for us here in Memphis, because Washington and Nashville don't care a whole lot about Memphis, but we have the ability to improve the health of our own community.
So while they're not paying attention, we can get it done.
Yes.
But doctor, how do we do that? I mean, is it done one person at a time? How do we do that locally here?
Yeah, well, actually, what this book is all about is how to do that. Both as an individual, to start with, you need to find the way how I can live a healthy life myself. But we do not live healthy lives in isolation. It is all built around community. People who live isolated lives rarely achieve health. The same thing's true that we in the community of faith have to say that the body God's given us is critical to my being healthy. But there's two things that Memphis has in abundance: poverty and religion. You know, we ought to be able to marry those two things together, because one thing that poor people have is an abundance of spiritual wealth. And we in Memphis can lead the country, I believe, in defining how do we use that spiritual strength that we do have as a city to make ourselves healthy. But you know, the church is one of the great offenders. The least healthy meal you can eat every week is at a church.
Absolutely.
You know, if your church has to have fried chicken in order to draw a crowd, there's something wrong with the message.
You're right about that.
It's a revolutionary message in many ways. Thank you so much.
Good. Well, I hope people will take a look at the book, because I do think that it makes a difference in anybody's life about how they can live a healthy life.
And there's your information right there. The book launch party, Sunday from 2 o'clock until 4 o'clock at the Church Health Center on Union Avenue.
Terrific.
Doctor, thank you very much.
Thank y'all.
So good to see you.